10% of women's world's female population are experiencing disruption every month due to their menstrual periods, owing to a condition known as endometriosis, which is painful monthly periods.
Well, besides the pain, the condition is prohibitive. Healthcare practitioners are now asking the government to factor the treatment and management of endometriosis into the new social health insurance fund. Well, Brenda Wanga reports on the efforts to reclaim the lives of those affected.
Exact function. So quality of life in Kwanga very much affected na endometriosis. Nimefanya 2 surgeries for it. Na bado because by the time nilikuwa nakuwa diagnosed ilikuwa late.
It dwells around pain. So pain, periods, pain.
Painful monthly periods is just one symptom of a condition known as endometriosis that affects women aged between 15 and 44. Doctors describe endometriosis as a condition in which the tissue lining of the uterus fails to shed during a menstrual cycle. This tissue builds up abnormally outside the uterus, leading to inflammation, scarring, and painful cysts.
Endometriosis is a chronic, inflammatory, debilitating, distressing disorder of multiple possible theories. So it's called a disease of theories. There is no exact cause.
The abnormal growth of tissue can also grow beyond the uterus and affect the bladder, the cervix, the intestines, the rectum, the abdomen, and the stomach. A team of specialists attend to a patient in Nairobi. Surgeries like this are one of the ways of managing this condition that affects millions of women around the globe.
And I'm an endo warrior. I'm here for the endometriosis surgery.
Judy Muriuki has lived with this condition for years, first without knowing what it was. Like millions of women across the globe, her condition was initially dismissed as normal, painful periods. It wasn't until adulthood and many painful episodes later that she got the proper diagnosis and started to get the proper treatment of the condition. This is her first surgery to try and treat it.
And to get back to my normal life. That's my main thing. Pain-free, just be able to do everything that I've been wanting to do.
Managing that pain is something that Wagani Warui knows only too well. Unlike Judy, she has had a number of surgeries to manage the pain that has left nearly all spheres of her lives in tatters.
Being in a space where watu hawaelewi, haukai mgonjwa, watu wakikuangalia waoni kama we ni mgonjwa, but unasema hawezi enda kazi, kama hata friendship ina affect because kuna siku zingine kama ni events ama watu wanataka kupatana hawezi tokea because sasa maisha yako iko around your periods. So unajua if you're having your periods siku kama 7-10 hauwezi panga kitu kwa sababu lazima utadeal na pain, lazima udeal with the mental everything.
Endometriosis affects about 200 million women worldwide, with no proper data on the number affected in Kenya, largely due to the stigma and misdiagnosis of the condition in Kenya. It manifests in pain before, during, and after periods, ovulation, bleeding with bowel movements, pain during intercourse, pelvic pain, painful urination, and severe lower abdominal discomfort, heavy periods, and infertility. In Nairobi, women affected by the condition can now access the life-saving surgeries at the newly established Endometriosis Center. The specialist doctors helping treat and manage the condition, however, say the government must include this condition in the financing of the management as the cost of the surgeries are prohibitive, leaving many women in untold pain. Brenda Wanga, Citizen TV.